Okay, so impingement of the supraspinatus. This is the most common shoulder issue that I see. So the supraspinatus sits in the supraspinous fossa of the shoulder blade, which is just onto the top there, comes across, goes underneath that hard bone there, which is the acromion, reappears onto the shoulder after it passes through a little tunnel underneath the acromion. So the supraspinatus causes abduction, which is coming out to the side, and then it also causes external rotation through like that. So supraspinatus impingement is usually down to a fault in the mechanics of the shoulder blade. Quite often the anterior structures tighten, and then because the muscles in between the shoulder blades become long and weak, we sort of lose contact with them, so then we lose the shoulder and scapular stability. And as the shoulder blade comes over, it basically increases the likelihood that that tendon is going to get pinched as the space narrows and narrows to the point where the tendon just gets caught and then becomes inflamed. So we're going to go through 5 steps for the acute management of the impingement of the supraspinatus tendon. So number 1, we need to diagnose it. 2, we need to cut out the aggravating factors. 3, we need to reduce the inflammation. 4, increase the stability through the scapula. And then 5, reduce the tension within the muscles. So number 1, diagnose. Go see your osteopath and get it diagnosed, and then you know what you're dealing with. If you can't get to see somebody at this moment in time, then I can run through a few orthopaedic tests that you can do at home. At least that can point you in a bit of a direction as to what it might be. Obviously it's not as good as seeing somebody in the flesh, but at least it'll point in the right direction. So number 1, we'll go through Hawkins-Kennedy test. So bring your arm out in front of you like that. Just push through the affected side, bringing it into an internal rotation. If you've got impingement at the shoulder there, it's probably going to reproduce some pain. We can do Neer's test, so bring your arm up and then point your thumb down and then raise up through like that. Again, if you've got impingement, you're probably going to get a little bit of discomfort through there. Number 2, we need to cut out the aggravating factors. So with impingement, you have something called the painful arc. Now the painful arc basically runs from about 80 degrees up to 120. So anywhere between that area is going to cause pain with someone with impingement of the supraspinatus. So just stop doing it basically. There's a lot of musculoskeletal injuries where it's good to move through a little bit of pain, but this isn't one of them. Basically you're letting the pain whenever the acromion is pressing down on the tendon. If the acromion presses down on the tendon inflames, and that space where the tendon goes through gets narrower, then it's more likely to trap the tendon again, lead to more inflammation, lead to more pain, lead to more getting trapped, and then the cycle just goes round. So that's why it's quite common for people with impingement to have it for a long time, because they don't sort of break through that sort of vicious cycle. And I see a lot of patients that have had it for a while and they thought they was doing good by moving it, which is understandable because, as I said, most musculoskeletal issues, it's good to go through a bit of pain, but this isn't one of them. So first off, just stop any movement that causes pain. Generally with supraspinatus, it's when the elbows come away from the body. If you can keep them narrow, generally in a flexion like that is generally okay. So if you need to reach into a cupboard and reach off to the side, don't do it. Just turn and face it and then reach in a sort of forward plane like that, and it should be generally okay. Don't lay on that side. Lay on the affected side is going to prolong the time that you're going to have it for, definitely. So cut out the aggravating factors. Number 3, we need to reduce inflammation. So although inflammation's there for good, inflammation's there to encourage healing, the reason you're getting pain is because the tendon is inflamed. That's reducing the space that the tendon can move through, and then it leads to more inflammation. And as I said, the cycle just goes round. So within the first 48 hours of the onset, I would recommend just ice on the area for 20 minutes, and then that will bring down the inflammation through there a little bit and make the pain levels a bit more manageable. After 48 hours from the onset, do contrast bathing. So contrast bathing is swapping ice and heat every 5 minutes. So if we do that for 20 minutes, it will go ice for 5, heat for 5, ice for 5, heat for 5. That'll encourage the flushing out of the bad inflammation, then it'll get the good inflammation and encourage a bit of healing if there's been any like micro tears, anything like that. So number 4, we need to work on scapular stability. So scapular stability is really important, and as I said, the muscles in between the shoulder blades, so the mid traps and the lower traps mostly, we lose contact with those muscles, we stop using them, we just rely on the muscles at the front. They're stronger, they come and bring the shoulders anterior like that, and that reduces the space for the tendon to pass through. So what we need to do, we need to open up the chest and get the shoulder blades and the postural muscles working a little bit better and more efficiently. So I'll just go through some exercises now with you to do for the shoulder blades scapular stability.
So to set the scapula in a correct posture, we need to engage both the middle and the lower trapezius. So if you squeeze your shoulder blades as tightly as you can, relax off halfway, and then relax off halfway again, all the while pushing the shoulder blades down towards the ground. This will encourage a neuromuscular control within the middle and lower trapezius, a muscle that a lot of people lose contact with. So if you look at this from the side, stand up straight, and then pinch those shoulder blades as hard as you can, relax off halfway, and then halfway again, all the while pushing the shoulder blades down. And just get used to sitting in this posture or standing in this posture at various points throughout the day. So for this middle trapezius activation, we're going to stand up straight, hands down by our side, and then stick our thumbs forwards. We're going to bring our arms back. At the same time, we're going to externally rotate them like this, shown here. So rotate the thumbs outwards and then also bring your arms back so you can squeeze the shoulder blades together. So if we put all of that together, bring the arms back the way, all the while turning the thumbs outwards, and then if you look at the shoulder blades, you can see how they're squeezing together there. We're going to hold that squeeze for 2 seconds, do 10 repetitions of that, and then try that 4 times a day if you can.
So with muscle activations, particularly for the middle and lower trapezius exercises, don't expect to feel like you know exactly what you're doing straight away. So these are muscles that you may not be using if you've got rounded shoulders. So it can take quite a while, weeks, months, to re-establish that neuromuscular control, which is the link of the brain using a muscle. So at the moment, if you don't know how to tense that muscle, it's going to take some time re-establishing that education of your brain being able to actively contract that muscle. Number 5, we need to reduce the muscular tension in the muscles that are causing or exacerbating the impingement further. So quite often there's a few muscles that I sort of find in practice that are sort of common exacerbators of the issue. So the upper trapezius is one of the first ones to tighten up. As that tightens up, that tries compensating for that abduction. So quite often, people with impingement, rather than bringing out to the side, they hitch the shoulder first, like that. So the upper trapezius muscles the fibres are firing early because they're already so tight. So we need to loosen off that one first. We need to stretch out the rotator cuff. So the rotator cuff muscles, namely the infraspinatus and the teres group, if they're really tight in there, the shoulder blade will wing out further, and then again that's going to aggravate some of the impingement through there. We need to work on pec major, pec minor. So pec major internally rotates, the pec minor will cause an anterior nodding of the shoulder blade. So as the shoulder blade comes up and round, again it's going to increase the impingement through into there, just as the acromion is part of that scapular bone. So as it comes up and round, it's just going to impinge a little bit more. Okay, so pendulum exercise. Now I prescribe this to pretty much all of my impingement shoulder patients and pretty much to most of my shoulder patients. It's a really useful exercise at creating a bit of traction through the shoulder joint. So I'm going to use a bottle of water here just to add a little bit of weight to my arm like that. So as I move my body, my arm should follow the movement, hence why it's called the pendulum exercise. So the incorrect way to do this would be to engage the arm and then move like that. Because if you're creating movement through your shoulder muscles, then the shoulder is not relaxed and then it won't create any traction through the shoulder joint. So you really have to make sure that the arm is relaxed as much as possible, like that. And then as you move your body, the arm should follow the movements like that. So you can go back and forth, you can go side to side, you can do clockwise movements or anti-clockwise movements. It doesn't really matter, make the movements as random as possible. It may take a few weeks just to get used to relaxing those muscle fibres, because it is a bit of a skill in itself. A lot of patients that I show it initially, the first few days, maybe up to a week, they have a little bit of an issue with actually relaxing the shoulder. So if this is you, don't worry, it's completely normal. What I say to patients with this issue is just to let the arm hang free, really relax it, and then test it with your other hand like that, and then just push it away. If it's relaxed, it should sort of naturally swing on its own. If it's tense, you won't be able to push it, or when you do push it, it's quite unnatural and you're sort of moving it that way. So with that, give that a go for around 2 minutes a day if you can. More the merrier on that exercise. There's no real sort of time frame or time limit that you sort of need to adhere to, but it's quite a simple exercise, so the more you can do it, the better.
So for this one, you're going to need something that allows your head to go past at the side. Something like a door frame would be quite good. Start on the top of your shoulder, and I'm moving here just to show the range you can move within the muscle. Once you've done the top of the muscle, rotate your body away, and then that'll allow you to get into the posterior fibres of the upper trapezius. Again, I'm just moving to show that the range that you can do. You're basically going from the base of the neck across onto the acromion on the outskirts of the shoulder. Once more, you can rotate away again, and then that will get into a slightly different position within the upper trapezius. Lay on the affected side that you wish to work on. Have your arm out at a 90-degree angle from the body, and then bend your elbow at a 90-degree angle. You can either have it as a static hold, or move your body back and forth over the trigger point ball like this. You can also use your arm as a lever by bringing it into internal rotation, like this. This will then create an active release. Be mindful, if you have an impingement, internal rotation might aggravate it. So there's two ways you can do this one. You can lay face down on the floor, or you can do it like this and standing facing the wall. Pick a spot within the pectoral muscle, and you can either move back and forth across the muscle in a gentle fashion like this, or you can just pick a trigger point and then hold it in a static hold like this. To increase the stretch within the trigger point, put the pectoral muscle on stretch like this and bring the hand out onto the wall, and then do the same again.
So it attaches just onto the outside of the humerus through onto here. As I mentioned, it comes through up in a pulley like that. So you tend to get a little bit of inflammation and increasing the tension of the deltoid fibres and then of the supraspinatus tendon onto there. Often part of treatment, what I do is a little bit of deep tissue friction. So that's basically just pressing and manipulating those little fibres into there. It will reduce a bit of tension in the muscles there, reduce a bit of pain, and it will stir up a bit of inflammation, so that will again encourage the healing process. So as you do this, it will be a little bit tender, so all you need to do is use like your middle finger or 2 fingers like that, come onto the area. You're basically going to be working anywhere on that sort of crest there, so if you just try pressing in until you find a tender spot. So once you've found a tender spot, you can just hold one finger into it like that and leave the pressure onto there. So over the 10 seconds, you will find that the tenderness does reduce a little bit. So what might start out as a 6 out of 10, over 10 seconds might go down to a 4 out of 10. So if you just work your way along that line there, or through the deltoid there, for around 2 to 3 minutes, we'll be a little bit sore after, but only do that either 2 or 3 times a week.